Fellow countrymen and countrywomen, today, July 11th, Uganda joined the rest of the world to commemorate the World Population Day for this year. The theme for this year's World Population Day, Leveraging Uganda's Population Dynamics for a Resilient Future Amidst COVID-19, end of quotes, is very timely. One of the practices we have used during this pandemic is the washing of hands with water and soap. This has helped us with coronavirus, but it can also help us with other diseases if we continue with this good habit. We in Uganda have also realized that food security is key to the population during a crisis like this one of the pandemic, but also in any other crisis, be it locusts, floods, etc. Uganda has a predominantly young population, with those aged 0 to 14 years being 47.9%, and those below 30 years being 78%. As Ugandans are aware, young people tend to withstand COVID-19 better than the more elderly population. In this regard, Uganda's population age structure, being predominantly young, is working in our favor in the fight against COVID-19 pandemic. Although here we should be very careful, we should really concentrate on avoiding COVID. This is because I'm beginning to see statements in Europe and the United States to the effect that even when you recover, the virus can cause you lifelong damages to the lungs, they're even talking of the brain. So we should not be too much anxious to get sick and then be cured. Yes, you may be cured, but you may get long-term damage. This morning I was watching one doctor who was saying that in the autopsy of the people who died from corona, that they found blood clots in all the organs of the body. That's very serious. That they found blood clots in all the organs. That's what the doctor said. So yes, our recoveries are high, but please, our priority is to avoid until we get a vaccine or a clearer treatment which can deal with the virus before it does the damage to the body. Deal with because now what we are depending on is for the body to defeat the virus itself with the support of some medical interventions to control temperature, to control that, to control overreaction, to control. But it is the body doing much of the work of defeating the virus. So until we get a vaccine or a more targeted treatment, avoiding is much, much, much better. The NRM government will continue to provide these young people with education skills, jobs, and health care so that they can be gainfully employed or employ themselves, save and invest so that they become the engine of economic growth. This is the demographic dividend people have been talking about, i.e., the economic benefits we have out of our growing youthful population, if they know what to do. For some time now, I've been stressing this point, that our youthful population is our greatest asset. These young people are not a problem at all. They're actually a big advantage. Regarding health of our population, we have noticed that in spite of the epidemic, we continue to witness an increase in lifestyle diseases. Lifestyle diseases or non-communicable diseases include diabetes, hypertension, obesity, and cancers. The percentage of the population aged 10 plus with non-communicable diseases is that high blood pressure in 2013 was 3.2%. In 2016, it was 3.5%. Heart disease has also been going up. This means that in Uganda, 891,000 people have high blood pressure, 534,000 people have heart diseases, and 229,000 people have diabetes. These diseases can be prevented if leaders give our people the right information and knowledge, like on proper nutrition, physical exercise, avoiding stress, etc. I urge all leaders to strengthen community mobilization using local radio stations to educate the masses about these preventable conditions. Because you can see, we almost have 2 million people who are above the age of 10 who have high blood pressure, heart disease, or diabetes, almost 2 million. Ugandans will recall that when the NRM came to power, we had many unfavorable indicators within the population. However, since then, we have turned things around and we have made a number of gains. For example, before 1986, there was low immunization, poor hygiene, high rates of malnutrition, infectious diseases, limited access to health services, etc. All these led to high levels of sickness and death. We have since reversed all this, and we are making progress in a number of areas. Uganda's population has increased from 14 million people in 1986 to 43 million currently. The population is projected to reach 50 million people by 2025 and 102 million people by 2050. In spite of the increase of the population, Ugandans are now living longer. Life expectancy in Uganda has increased by 20 years in one generation, from 43 years in 1991 to 63.3 years in 2017. Now, as a result of increased immunization against killer diseases and other pro-people programs, our children are dying less. Infant mortality rate reduced from 122 per 1,000 live birth in 1986 to 43 per 1,000 live birth in 2016. That's why the population increased. Because before that, you Ugandans, you were marrying many women, but the children were nowhere to be seen. Because our population was 6.5 million. You know, I was there, what you call history, I call current affairs. In 1962, population was 6.5 million. When we come back from fighting Amin, after 18 years, when we had the census of 80, 79, population was 12 million. And the 5 years we spent in the bush, when we came, we carried out the census later in 1991. By that time it was like, I think 16 million. So by 1986 it was 14 million. So this big increase of almost 3 times is really because of the immunization. Poverty has reduced from 56% in 1986 to 21.4% in 2017. It had actually gone to 19%, but the other drought, because we have got many of our people in the language of the Bagwere that are still working for only the stomach. Abakorere kida kyonka. In Luo, teach, me each, keken. This is in Luo. So, because of that, these are very vulnerable. When you have a small drought, somebody who had become all right goes back to poverty line. Why? Because he does not have a bank account. Because if I have a bank account, even if my cows die in 2020, my bank account is there. I will not starve. But when I'm living from hand to mouth, any disequilibrium, I go back below the poverty line. But otherwise, the poverty level had come to 19% for the whole country. Percentage of the population with access to electricity more than doubled from 11% in 2010 to 23% in 2016. The total tarmac road network is now 4,966, almost 5,000 kilometers. When the roads under construction are finished, the total will be 7,000 kilometers of tarmac roads. The total installed power generation capacity is 1,254 megawatts. It will soon stand at 1,767 with the commissioning of Karuma, Agago, and other plants from the 60 megawatt of 1986. However, the challenge we are now addressing is the 68% of the households which are still stuck in subsistence economy. Abakorera kida kyonka. Teach, mecham, keken. That's where the problem is. We are handling this through operational wealth creation, microfinance, putting money in a myoga. Myoga means special trades, special emyoga, like you can call it profession if you like. Of course, we can use the word trade, but trade our people may not know it very well. But that's what, if you are a blacksmith, that's a mwoga. If you are a metal, you are a metal worker, that's a mwoga. You are omhesi. If you are a carpenter, umbeizi, that's omwoga. If you are using ceramics, umnogozi, umbumbi, that's omwoga. If there are so many myoga, even traditionally, the ones who were making shoes, we are called abaremi, ukuremenkeito. That's omwoga. If you are a herbalist, you are umshakizi. Umshakizi, that's your mwoga. Ukushakira. If you are transporting people in the lake, we call you abarimbi. These are the lake people, the ones who knew how to transport people either in boats or even in rafts. If you specialize in burying people, they had funeral services. These are abashitsi. You are like the hyena taking the dead people. They were called abashitsi. So, we are using this traditional concept of omwoga so that each one goes where you belong. If you are a hair salonist, that's your omwoga now. If you are a mechanic, that's your omwoga. So, we have put money in this myoga, value addition, and agro-processing by supporting UDB and UDC. This coupled with our import and export promotion strategy, import substitution and export promotion strategy, to stop the hemorrhage of the forex through the high import bill of US $7.1 billion. Currently, we lead the population to, we believe, a prosperous and better quality of life. Lastly, I wish to inform you that the government will continue to give priority to issues of our youth by empowering them so that they improve their welfare and contribute positively towards Uganda's development. The other mwoga was the ones who are making back cloth, who are making cloth from the mutuba, the fig tree. Those were called abakomaji, or komaga. Then the ones who were making bows and arrows, those are abatanaji. So these are the myoga. This is the concept, the traditional concept of omwoga. Each one who had a speciality, that was, and he would specialize in that, do nothing else. Other people would produce food and come and buy from him by barter trade. So that concept of myoga will help us. I wish all Ugandans a happy World Population Day. Thank you so much.